Department Child Specialist Dr. Lesley Bamford is with us now to talk more about this. Doctor, a very good evening to you. You and I spoke just after the plans for the vaccination of children were announced, and now you're mulling at offering a third, fourth dose for those categories of adults. What is going to determine whether that happens at this stage? Dr. Bamford, are you able to hear me? Okay, I don't think Dr. Lesley Bamford...
Good evening. I can hear you. It's a little bit faint, but I can hear you, yes. Can you hear me?
I can hear you clearly. I'll just give it another go then. I was just asking about what it is that's going to determine whether these third and fourth shots for COVID are actually administered.
So, good evening, and good evening to viewers. So let's just remind ourselves that currently adults in South Africa, adults 18 to 49 years of age, are eligible to receive 3 doses of the vaccines in total, and people 50 years and older are able to receive 4 doses. So our priority remains to ensure that people receive these doses, so that people who are unvaccinated receive their first dose, and people who have started on their vaccination journey receive the doses that they are currently eligible for. At the same time, we have had many requests and queries from people as to whether we will be introducing any additional booster doses, and what was indicated today is that this is under consideration, and we do anticipate that additional boosters will be made available early next year, probably during February. We will not pursue active campaigns to vaccinate people because for now, for the majority of people, we consider that the 3 or 4 doses are adequate, but we will make these doses available. So if there are people who would like to receive additional booster doses or require these doses for some reason, that they will be available.
And let's talk efficacy over the long term. For those of us in the main, I think, who would have had the first 2 shots of the double dose vaccine and maybe a booster down the line, is all of that, let's say, for example, if you're vaccinated in early 2021, for instance, is it still as effective today as far as offering the protection at initial jabs?
So there's a lot that we don't know. What we do know is that vaccination continues to provide the best protection against COVID, particularly severe COVID and death, but also against long COVID. Secondly, we know that in South Africa we have high levels of immunity as a result of both vaccination and, in some instances, natural infection. We also know that over time, the protection, someone's immunity does wane. So there are a lot of factors that we need to take into account in deciding whether to recommend further doses or not. So currently it is a field that is evolving, and we are watching the evolving evidence very clearly and trying to respond on the basis of the evolving evidence.
And how rapidly is the evidence evolving at this stage?
So the evidence continues to evolve. There have been many clinical trials, and so the evidence from those trials is continuously becoming available. What is unpredictable is, of course, how the virus responds. We know that each of the waves in South Africa has been associated with the emergence of a new variant. So we need to watch very carefully and respond to the emergence of any new variants. Mm-hmm. Currently, we don't see any new variants on the horizon, but we know that these variants can emerge and become dominant very quickly.
How concerned is the South African Health Department about possible mutations as China is dealing now with its largest outbreak in a while?
So China is a very specific case. There have been relatively little or low levels of infection. So many people have not been exposed to the virus. And in some groups in China, vaccination coverage, particularly in older persons, is lower than ideal. But the infections in China are related to the Omicron variant. So the increase in the number of cases in China is more related to opening up and lifting of restrictions than to the emergence of a new variant.
Thank you very much for that, Dr. Lesley Bamford from the National Health Department.